So after any shoulder surgery or shoulder injury, sometimes we keep you in a sling for quite a period of time to let things heal. That doesn't mean we can't introduce motion in a safe way to the shoulder. So one of the best exercises to do that are called pendulum exercises. So we have Amy Waterall here, who's one of our head physical therapists, and she's going to help demonstrate how to do these pendulum exercises.
Okay, so first, coming out of the sling, as you're gradually lowering the arm down, you're using your unaffected, your non-surgical side to lower that arm down. We'll have you support your body on a table or chair. You're going to bend forward, letting your arm just hang towards the floor, and gradually start some motion with your body, allowing that arm to swing freely. And you're creating that motion through your trunk and through your legs.
Wonderful. So we call this a passive range of motion device, or exercise rather, that doesn't actively recruit the rotator cuff muscles and should not affect any sort of repair we've done.